Hello.
Hey everyone, I'm just going to give people a minute to join and then we'll get started.
Hi, Elizabeth. Meanwhile, we could socialize.
Hi, Reza. How are you?
It's been so long. It's been a while, Elizabeth.
That's true. It's true. Congrats on your new book.
Oh, thank you. Thank you. And I'm so happy you are retiring. You're too young to do that.
I am retiring. I'm not too young.
Um,
I'm enjoying it a lot. I started in January.
The students are, I feel bad for the future students at Bates.
Thanks.
They're an amazing anthropologist, and but I'm so glad that we still have you here in our community.
Oh, yes. I'm not going anywhere.
Well, we're happy about that, and I would love to give you a tour of our center at some point, Elizabeth.
That would be great. Thank you.
I would love to, and
I would love to do it.
well,
And if you know, now that I'm retired, I can offer my consulting services to anyone who needs it.
well, I need you as my personal coach. So I thank you. I was coming to that. If I could.
Not necessarily you could teach me, but I mean, no. If people need, brain power or some
We
energy.
need your brain power. Hello to everyone.
Hi.
Hi,
Hi,
Reza.
Alan.
Hi, how are you?
Almost Happy Nowruz, almost.
Happy Nowruz to you. Yes.
Almost.
Tomorrow is New Year for us.
It's coming, yeah.
Yeah, Persian New Year and Azerbaijani New Year and
Afghani. Today I was at the Zoom meeting with the State Department and the ambassadors of these Central Asian countries and Afghanistan. Hopefully one day also Iranian ambassadors too.
I hope so. I hope so that the relationship would get to be normal
Yes.
again. And Artalan, so good to see you.
Good to
owe
see you too.
phone calls, text messages.
I know.
So patient with me.
How's your vaccine?
I'm doing really well. We were sick.
We are all vaccinated. We are happy. And thank you to Dr. Shah,
Well, thanks to that.
who is not available anymore. He was like more available before, like 2 months ago. Now you can never find. He's very busy. We know.
A couple of things going on. Yeah.
Oh, he's here. Hi, Dr. Shah.
Hi, everyone.
Okay, I think we are okay to just go ahead and get started. Welcome everyone to our second Health Roundtable with Dr. Shah. I just want to thank everyone for coming, and thank you, Dr. Shah and his team, for making time for us. I'm just going to quickly go over the formats, and then we will be shortly going into the Q&A. We ask that everyone just submits their questions into the chat, and you can go ahead and get started with that. And we'll have our moderator, Amy, just pull the questions out of the chat and consolidate them if necessary, and relay them to Dr. Shah. That way we can keep things running as smoothly as possible. We'll stop just a few minutes at the end just for a brief conclusion for Dr. Shah. And just quickly before we begin, we'd like to ask everyone for just a brief moment of silence in light of recent national events. Just a brief moment of silence. Thank you, everyone. It has been a very difficult and unprecedented week for our community, but together, I believe we can all get through it. But yeah, we want to dive straight into the Q&A. So Dr. Shah, if you want to just give a brief introduction, and we can go ahead and get started.
Great. Well, hello, everyone, and it's a pleasure to be able to join you. I'll talk about COVID in a second, but I do think, as Thomas noticed, it's important to acknowledge the time and the week in which we are gathering, a week in which a lot of latent prejudices and scars have been borne bare, and challenges that face all of us in our respective communities. And I want to thank everybody for not just the opportunity to join you to talk openly about these challenges, but also for the work that all of you have been doing to try to help heal some of these rifts. I can't think of a time in recent history where these concerns around prejudice have been just brought so starkly to our attention, culminating, unfortunately, in the tragic loss of life that we saw earlier this week. I know that this is a very difficult time for so many, including in light of recent events here in Maine as well. But I know that there are, and we can talk about this at the end, but notwithstanding the darkness, there are also examples of goodness that comes from that. And these are a reminder that even when things aren't so great, we can still look for opportunities to make them better and keep working in that direction. So I just want to start by acknowledging the challenges, and but also applauding everybody for continuing to do the right work and do the right thing. With respect to COVID, those challenges still remain, although we are starting to see some signs of hope, particularly around vaccinations, where we have now vaccinated just across the entire state. Over 500,000 doses have been administered of COVID-19 vaccine. That's over 1 in every 4 people in Maine who has gotten at least 1 dose of vaccine. And 15% of people in Maine have completed their entire vaccine series. So we are making progress. Indeed, in the not too distant future, we will likely be changing the way that we think about vaccine. Right now, the focus is around urgency of vaccination. But probably in the not too distant future, we will be shifting from urgency to hesitancy, folks who aren't quite sure if they want to get the vaccine or not. And that's what we're preparing for. And that's why I'm so happy to be able to talk to everybody today and take questions around that. So Amy, I'm gonna, without any further ado, I think the questions are what folks are here for. So I'll turn things over to you and let you walk us through.
Thank you so much, Dr. Shah, and thank you as always for your lovely words. I also just wanted to add, because I believe somebody, I think Reza or Tarlan was saying that it's been difficult to reach you because you're very, very busy. My friend, who I used to work at the Department of Education here in New York City, and she's from Maine, she saw that I had posted about our roundtable, and she texted me and said, "My family loves Dr. Shah. He's a celebrity in Maine. It's so cool that you get to talk to him." And so just wanted to let you know that you are a celebrity in Maine, Dr. Shah. So we're very happy to have you here with us. And thank you everybody who's sending in some questions. We did get a few questions in the survey, in the registration, because we did leave that space open. So I'll start with those, and then I'll get to the ones in the chat and a couple others that I have in my inbox as well. But first, I would like to ask you, what do we know about the many different kinds of SARS-CoV-2 strains and the vaccine coverage?
Great. That's wow. We're not wasting any time. We're going to get right into it. Okay,
Diving right
good.
in.
Let's dive right in. So folks have probably heard for the past few months now, there have been a lot of concern around new strains of the virus that have emerged across different places across the globe. And they go by a weird combination of numbers and letters. And so for that reason, some folks have talked about these strains based on where they were first identified. One was first identified in the UK, another was first identified in Brazil, another in South Africa, another in Southern California. So sometimes to make it easier, we talk about them based on where they first were found. But of course, as with any virus, it doesn't matter where it was first found because it spreads so quickly. Some of these variants, as they've been known, as they are called now, some of them are really concerning. The one that was first identified in the UK seems to be more contagious than the normal virus, and some early data suggests that it also results in more people being in the hospital. The same is being said of the variant that was first identified in Brazil, all of which raises questions around whether the vaccines will work. Well, thankfully, the 3 vaccines that we have right now in the United States, one from Pfizer, one from Moderna, and a third from Johnson & Johnson. All 3 of those vaccines are thought to be very effective against all of the variants that are circulating right now. There is a vaccine that is not being used in the United States yet, made by a British company, AstraZeneca and Oxford University, that did not seem to be as effective against that one variant from South Africa, but it was still very effective against many of the others. So right now, for the 3 vaccines that we have in the US, they are very effective, not just against the normal virus, but also the variants. But here's the other thing to think about. The way that these vaccines are being made now is using very sophisticated engineering techniques by some of the best scientists around the world. And they have already started thinking about and planning for the possibility that there may be a new variant out there that doesn't work as well against the vaccine that we have. And so they're already thinking about how to update the vaccine the same way we do with the flu shot every year, so that it continues to be effective against the variants going forward.
Great, thank you. Kind of in that vein, you mentioned those 3 different vaccines that we have available to us in the United States. One of our community members was wondering if there had been any deaths reported from the new Johnson & Johnson vaccine.
No, there have been no deaths reported that are confirmed to be caused by the vaccine from any of the 3 vaccines anywhere in the globe. And so whether it's the Johnson & Johnson vaccine, the Pfizer vaccine, or the Moderna vaccine, they are 100% safe in that respect, i.e. they haven't caused anyone to die, but they're also 100% effective at keeping people alive if they are infected with COVID. So not only is no one dying from the vaccine, if you get COVID, your chances of survival, if you've been vaccinated, are 100%.
Thank you. I think that some people in our community feel that the brand name Johnson & Johnson is difficult to trust, given some of their past history with some of their products. So what would you say to somebody who is like a little bit nervous about getting that particular vaccine?
Well, let me first talk about the safety and then make one other observation after that. The safety of the Johnson & Johnson vaccine, what we know about it is that in the trials that it was designed to be evaluated in, tens of thousands of people received the vaccine. And ever since it has been approved, hundreds of thousands of people have received the vaccine. And because of how much scrutiny there is around vaccines, every single little thing that happens to somebody after they get a shot is investigated. No matter if you got a headache or if you got any type of reaction that might have happened anyways, we take those seriously. And there's some degree of investigation that happens. So the spotlight is really on these vaccines. in a way that it's not for other types of things. As a result of that, we have a pretty good sense of what's happening with the safety of vaccines. And ever since the Johnson & Johnson vaccine was approved in the United States earlier this month, again, thousands of people have received shots of it. And there have been no reported instances of deaths, allergies, severe side effects or reactions that are thought to be that were thought to be caused by the vaccine. So if one of my family members was needing to get a vaccine and they went somewhere where the Johnson & Johnson vaccine is what was being given out that day, and they called me and said, hey, I've got concerns, I would say, don't worry, you should go ahead and get the shot.
Awesome. That's what we want to hear. So for those who have gotten the vaccine, some are wondering, what are the precautions that they should still take? I think there's a lot of different information out there, and they're just wondering, if they could get some clarity on what precautions to take, even if you're fully vaccinated.
Well, that's again, a really great question, because you might think that after you're vaccinated, everything can go back to normal, right? And I've had a lot of folks say, well, okay, hold on now, wait a minute. After I get vaccinated, you mean I can't just go back and live as if COVID didn't exist? And unfortunately, the answer is not exactly yet. So let's talk about what you should keep doing after you get vaccinated, but then also talk about what you can stop doing. After you get vaccinated, there are two key things that you should keep doing. Number one is wearing a mask, particularly when you're out in public, whether you're at the grocery store or wherever you may be. If you're not with people who you live with, you're outside of your house, you should still keep wearing a mask. The reason why is a few things. The first is we have a pretty good sense that the vaccines do a really good job at preventing people from getting infected, but we don't have all the data quite yet. So we want to make sure people are still taking steps to protect themselves. The other reason to keep wearing a mask is that although the likelihood of getting reinfected with COVID is really low, it's not zero. And as we think about some of these new variants that you mentioned just a moment ago, Amy, we want to keep people as safe as possible. So that's why, even though you've been vaccinated, we still think the best thing to do is to keep wearing a mask and still keep physically distancing from person to person. But let's talk about what you can do after you get a vaccine, what you should do after you get a vaccine. After you've been fully vaccinated, and fully vaccinated means at least 14 days after your second shot, or if you're getting the J&J, after your one and only shot. 14 days after that, if you want to get together with a group of friends who have also been fully vaccinated, if you want to get together at someone's house where everybody has been vaccinated and you want to get together for a meal or a celebration, you can do that and you don't need to wear masks. Another thing that you can do after you've been fully vaccinated is hold your grandkids. I think for a lot of people in our community, given who we've been vaccinating in Maine, one of the things they've missed out on is holding their grandkids or embracing their relatives. Once you've been fully vaccinated and you're interacting with somebody who's not thought to be at a high risk, like your grandkids, even if they haven't been vaccinated, you should feel free to hug them. There's also some other things that you can do after you've been vaccinated, things like travel. Right now in Maine, if you go to, say, Florida for a vacation, and then you come back, you have to stay in quarantine for 10 days or get a test. But if you're fully vaccinated, you can go somewhere and come back and not have to worry about quarantining or getting a test. So there are real benefits to getting vaccinated.
Thank you, Dr. Shah. I noticed a kind of a common thread between some of the questions coming in right now that are education related. So I'm gonna try to ask some of those questions right now. One of them is, as a teacher, after they're vaccinated, how will this change safety in their classroom? And then in that same vein, somebody asked, why is the distance between students now 3 feet? And like, why is that safe? And what else is changing, these different safety precautions when teachers are vaccinated?
Sure. Let's start with the first one. What changes when teachers can get vaccinated? In the immediate term, nothing changes for the classroom setting. We think vaccinating teachers is important because it keeps them safe, because they're interacting with so many different kids, so many different people in the workplace setting. So we think that vaccinating teachers is critical. But in the immediate term, it doesn't change anything directly in the classroom. It is, however, a step in the right direction to getting more and more kids back in the classroom, because that's something that's been a priority for the governor and for President Biden. In terms of the 3 feet versus 6 feet, Amy, I think what's really important there is back in July and August, before the US CDC put out any guidance whatsoever, my team or our team sat down to look at the data that we could find. And we actually thought that 3 feet was perfectly safe. Especially because there would be masking, there would be ventilation in classrooms. So I don't want to say, I said perfectly, I shouldn't say that. We thought that 3 feet was an acceptable distance between students and their desks. As your question sort of suggests, earlier today, the US CDC sort of caught up with us and they came out and said, yeah, 3 feet seems okay. The reason they moved from 6 feet to 3 feet was that really what we saw is that there's not been a difference in states who have had 3 feet of distance versus 6 feet. There really wasn't a difference in the COVID rates in those types of states. So we think that 3 feet is at least as safe as 6 feet. And again, in Maine, we've been at 3 feet ever since August. And so we're delighted to see that the US CDC is agreeing with the judgment call that we made back in July and August.
Thank you, Dr. Shah. Another question about like students, but this is about college students. The question is about college students who are out of state. When can they have the vaccine and how does that work for them?
Okay, so right now, the eligibility really depends on where you are a resident. Now, when you're a college kid, your residency is a little weird. If you're a Mainer, but you go to college in New Hampshire, are you a New Hampshire resident? Are you a Maine resident? Where should you get your vaccine? Yeah, it's a little bit confusing. This comes up in other areas too, like voting. If you went to high school in Maine, but you're going to college in Vermont, where should you vote? Well, the real answer here is that in the not too distant future, we think that the supply of vaccine will increase very, very significantly. So this question won't really be as difficult. If you are a college kid and you're from Maine, but you're going to college in Connecticut, you'll probably have an option of where you want to get vaccinated. And I think the best thing to do is to get vaccinated as soon as you're able to. If you're still in school and you're in another state, get vaccinated in that state. If you happen to be back in Maine, get vaccinated here. The key is to get vaccinated as soon as possible. The other thing I don't want to encourage is people making trips just to get vaccinated. There's no reason for someone to drive home to Maine from Pennsylvania, where they go to college, just to get vaccinated. There's no reason to travel. There's no reason to put that much carbon dioxide in the air. So what my colleagues and I across the country are trying to do is trying to standardize where kids can get vaccinated. In the not too distant future, there will be a lot more vaccine than we have now. And as a result of that, we probably won't really have to make that difficult choice.
Great, thank you. I hope that we don't have to make that difficult choice. You had mentioned in this last answer that if you get the opportunity to get the vaccine at your current school, you should get it regardless of whether or not you live in Maine. So there's a question that somebody had submitted before today that kind of resonates with that statement of like, just get it where you can get it. I'm of the opinion that if it's available to you, that you should get it. And I know that there are a lot of folks who say, other people, should go ahead of me. And while I completely understand that sentiment, I also just know that the more of us who get it, the better off we all are. This question is a little interesting. But I know that you're willing to dig deep today, Dr. Shah. So what is your view about the best way to manage the tension of wanting to celebrate when trusted community members get vaccinated with the stress and anxiety of those who want a shot but cannot get it?
Yes, that is a very good question. It's something that I've grappled with within my own family. You're right, because on one hand, we want to celebrate those who have been able to get vaccinated. On the other hand, we don't want to be unnecessarily prideful that some have been vaccinated when others haven't. I want to say two things about that. The first is one of the approaches, the reason, one of the effects of Governor Mills choosing to move strictly by age is that age is the one category that we are using. And in a group that I'm talking with today, being an elder matters. And so one of the benefits of this approach is that the elders in our community who happen to also be at a higher risk are those who are being vaccinated first. And those who are younger will be vaccinated, so on and so forth. So this trade-off is not as stark in Maine. The other thing that I will also, though, mention is we can do both. The human brain can simultaneously be happy that someone has been vaccinated, someone who's 60 or 70 years old, who is very high risk for COVID and death, and also not be so excessively happy so that's such that someone who is 50 or 40 who has not been vaccinated, it feels like they're being left out. Even within the categories of individuals who are 60 and 70, we can be happy for those who have managed to be vaccinated while also simultaneously working to help support finding a slot for someone who's 65 who hasn't been vaccinated. I think we can do both. The human mind can be happy for some people while we simultaneously keep trying to help other people who haven't got there yet. That's the approach I've taken with my own family.
I appreciate that insight, Dr. Shah. Thank you. It's a tough balancing act that we're all trying to do right now on top of so much else going on. Another great question is, oh shoot, where did it go? I just saw it. Okay. Has there been more research regarding whether people who are vaccinated can still spread COVID-19?
Yeah, that's a great question. I sort of referenced this a moment ago, and let me talk about the question a little bit more so that everyone has some background on it. There are two things to think about when you talk about COVID. Number one is, are you going to get sick? The second question is, are you going to spread it to somebody else? Most of the research around the vaccine has been about the first question. Does it prevent you from getting really sick? But there's also this other question. Does it prevent you from spreading it to somebody else? We have a lot of data on the first question. We know really well that the vaccines prevent people from personally getting sick. But we're starting to see now more and more data on the second question. And all of those papers and data and the scientists who have researched this question are starting to find consistently the vaccines not only keep you from getting sick, they also reduce the possibility that you'll spread the virus to somebody else. So they both reduce disease and infection. That's a really important thing because that means that by taking the vaccine, you are actually helping to keep not just yourself safe, but everyone around you. And all of the data continues to point in that direction. And Amy, let me connect that with something you mentioned a moment ago. I've had a lot of people who have emailed me or sent me messages who have said, I was somewhere and I happened to be at Walmart at 4:59 p.m. and I didn't even sign up for a vaccine, but they had one dose left and they offered it to me. And I didn't know if I should take it. So I said no, because I wanted someone else to take it. And my overall approach to that question is if someone offers you the dose and you are eligible, you should take it. Maybe there's somebody else who is more deserving, but you don't know if that dose is going to go in their arm or not. It may actually, if you decline it, go into somebody who's less deserving. The other thing, though, is that even if you do take the vaccine, even if you yourself are at a low risk, by reducing the likelihood that you could spread it, you're keeping everyone else around you safe as well.
Awesome. Thank you, Dr. Shah. I recently just found out that I'm considered a childcare worker because I support childcare staff. And as soon as I found that out, I was like, I'm signing up.
Yep.
Because
Don't
if I'm
delay.
eligible, I'm going to try. Because that means I can hug my grandma. So
Yes, exactly right.
that's
Exactly
why
right.
I want to do it. So I had a couple of questions about, and I saw two of these that kind of go together. So, oh, shoot, I keep losing them. Some states have open vaccination for all age groups, and all the vaccine manufacturers are producing their vaccines at maximum capacities already. So how can they go above and beyond to make sure that all Mainers above 18 can be vaccinated in May? And do you think that Maine will ever open this up to all age groups?
Well, we're looking at it. I don't want to get ahead of things because our population is a little bit different. Our population is generally an older population, whereas some states that have moved in that direction are much younger. So we are still working our way through older populations right now. That being said, we're making faster progress than I think a lot of folks anticipated that we would. So although I can't predict what the future could be, I would imagine that all Maine people will be eligible for a vaccine sooner than they think.
Awesome. Thank you. That's always great news to hear. And I have a question from one of our community members who speaks Vietnamese. So I would like to ask the question in English, and then I would like Thuy, our cultural broker, to step in and translate the question for just so that they know that their question is being asked. And then I will also ask Thuy to kind of translate your answer as well. So if you feel like it's going to be a long answer, maybe pause a little bit. But all right, thank you. So, you know, asking about age and when they're going to be available. When will people 45 and 50, you know, in that range, be able to get vaccinated? And can they choose whichever vaccine they want?
Dạ, Thung ơi, bây giờ là câu hỏi của Thung. Thì khi nào người từ 45 và 50 tuổi sẽ được tiêm vaccine? Và thì mình có thể chọn loại vaccine mình muốn hay không? Thank you.
Thanks, Thuy, for interpreting that. Right now, as it stands in Maine, people who are in their 40s to 49 are right now eligible for vaccine on May 1st. But based on the data that we are seeing about how much progress we're making, that date might get moved sooner. I don't know to when it might get moved, but it may get moved a little bit sooner. My team and I are reviewing the data every single day about how much progress we're making, so we can advise the governor about what date that should be. Maybe it will be a little bit sooner, maybe it will be much sooner. I can't speculate on that, but we are working on some announcements around that for the very near future. The other question, I can pause, or is that good?
Sure.
Okay.
Yes. Thung ơi, như vậy này thì như vậy là theo ông nói hiện tại bây giờ thì những người từ 40 đến 49 tuổi á, là có thể có được tiêm vaccine vào ngày mùng 1 tháng 5. Nhưng mà hiện tại bây giờ thì có nhiều cái sự tiến bộ rất nhiều, và cái đội ngũ của ông và những cái bạn đồng nghiệp hiện tại bây giờ á, là xem coi những cái thông tin hàng ngày, những cái dữ liệu hàng ngày. Thì như vậy á, sẽ có những cái sự tiến triển đổi mới, và ông sẽ khuyên cái người thủ phủ của Maine đây á, thì có thể rằng trong tương lai người 45 hoặc là 50 tuổi có thể được chích sớm hơn, và cái đó sẽ được thông báo. Cảm ơn câu hỏi của Thung nha. Thank you.
Thank you, Thuy. The other question is, can people choose which vaccine they want? And let me first say that the best vaccine for you is whichever one you can get first. There aren't really significant clinical differences for folks to suggest that they should try to get one vaccine or another vaccine. I'll pause there, Thuy.
Còn cái câu hỏi của Thung là Thung có thể chọn cái loại vaccine được 2 mũi hay không? Thì ông nói như vậy này, thì cái vaccine mà tốt nhất á, là cái vaccine mà nó có sẵn cho Thung. Cho nên á, là Ông theo cái câu nói của ông thì ông không có hẳn nói rằng là cái loại nào là tốt hay không, nhưng mà điều để mình hỏi lại, but Dr. Shah, can people choose what kind of vaccine they want? Will that
Well,
be available?
it right now it's possible, but it's difficult. Generally speaking, most vaccine sites only administer one vaccine. That way they don't make any mistakes or errors. So right now, the only way someone could try to choose is by looking at the list that we publish every Thursday and saying, okay, that site is administering the vaccine that I want, so I'm going to go there. But I don't recommend that people do that. I recommend that people get the very first vaccine that they can find and not try to pick and choose which vaccine they think is best, because all three are excellent.
Ok. Theo ông bác sĩ nói như vậy thùng này thì tất cả cả ba loại vaccine đều là rất tốt. Thì trong cái thời gian này mình không thể chọn cái loại vaccine mà mình muốn. Thì có thể là trong tương lai, nhưng mà thật sự ra rằng nếu như mà muốn thì người ta có đưa ra cái danh sách những cái loại vaccine cho từng nơi được tiêm vaccine. Thì mình nhìn vào danh sách đó để mình có thể biết là loại vaccine nào. Nhưng nói chung hiện tại bây giờ mình chưa có thể chọn được loại vaccine nào mà mình muốn. Cảm ơn Thung nha. Thank you, Dr. Shah.
Thank you. That's a good question.
Thank you. Okay, getting a couple of questions kind of around essential workers and who might be eligible. So I'm going to try to mount them into one. One of the questions was like, why aren't essential workers a priority right now? And then the other question was, you know, for excuse me, for people working on the refugee medical screening teams at certain organizations, we'd like to know when they can be vaccinated because they're an integral part of providing services to newly incoming refugees and asylees.
Sure. So as to essential workers, you know, Governor Mills has on numerous occasions expressed two principles around how she would approach everything related to COVID, including vaccines. Principle number one is her focus on saving as many lives as possible, keeping as many people alive as possible. Principle number two is there is no such thing in her mind as an essential worker because all workers are essential. As a result of that, the governor has opted to move on vaccinations by using an age-based system. The age-based system does a few things. It makes it very easy to determine when and where you should be vaccinated, or when, not where, when. It also avoids the challenges that a number of states have encountered around determining which essential workers or which individuals with which medical conditions should be included. When we were planning around vaccines, we started thinking about what it would look like if we took all of the essential workers using the federal government's classification and everyone with a chronic medical condition. And if you use that approach, which some states have, what you pretty quickly see is that on day one, 60, 70% of everyone in Maine is immediately eligible. So from there, you can do two things. You can just let people fight it out and say, hey, it's 1 million people, you guys figure it out, first come, first serve, everyone's eligible. Or you can say, well, within that group, we have to choose certain priorities. And then within that group, certain priorities. And then within that group, even certain priorities. It's doable. Some states have tried to do it, but it slows everything down. So that's why Governor Mills has decided to just use age, because age turns out to be a good predictor of other things, especially like your risk of dying. It's not the only predictor at all, but it's a good predictor. It's also one that has allowed us now to be the 4th highest state in terms of the percentage of people who have been vaccinated, who have gotten at least one dose. Yesterday we were 5th, I think today we're 4th. So it does mean that as many people can be vaccinated as possible, which means that we can move up the other age categories, hopefully sooner than we anticipated. I know that that's not what everybody wanted. Everybody wanted their group to be first in line, whether they were essential workers or people with certain medical conditions. But unfortunately, in a large system with 1.3 million people needing to be vaccinated, 2.6 million shots that needed to go in arms, we had to make a tough decision. And so that's why Governor Mills opted to use age as one of the criteria. To Tarlin, to your specific question about the refugee medical coordinators, I'm going to take a closer look at that. I don't think it fits within our description of phase 1A. I think the answer is unfortunately not right now, but if that changes, Tarlin, I will let you know.
Thank you. Because, we have been receiving so much, like pushback from our own, providers. They are kind of under risk, and they are the first people seeing this newly arrived refugees, specifically because we had some families, they came and after like a week or so, they become a COVID-19 family of 6. And for 2 months, actually, that was so difficult. So what I was trying to say, if this is any way we can really make exceptions, that's the worst to do it, because we wanted to protect both parts, new arrived families and also those who support them here, providing the services. Specifically, I'm talking about the medical screening team, which is really important and integral part in our services, and that's what I just brought to your office.
Yep.
Thank
Thanks,
you.
Tarlin. Thank you.
Thank you so much. So we're running short on time. I'm going to try really hard to squeeze these last few questions in. But, as we were talking about the age rollout and the difficulties of making these decisions when you're trying to vaccinate 1.3 million people. In terms of age rollouts, are people who are incarcerated who are eligible, will they be included in this rollout? Yes?
Yes.
Great.
Yep.
And then
by age.
Okay, yes, by
Yeah,
age.
by age.
Sure. And then somebody else asked that there are judges, clerks, and bailiffs who are being vaccinated, but attorneys who are regularly in court and who are working with the community are not getting vaccinated. When can those attorney advocates be vaccinated because they feel like the district attorney's office is vaccinated and they're circumventing the age requirement?
I think those, so certain law enforcement personnel like bailiffs, corrections officers, police, were eligible to be vaccinated under phase 1A. But for those not within that very tight group, again, bailiffs, law enforcement, corrections officers, they will be vaccinated as part of their age tier.
Thank you. I think hopefully this will be a quick question, as I know we're coming up on time, but if someone is fully vaccinated, can they safely travel overseas soon?
Well, they can safely travel overseas, yes, or as within other safety measures and always observed. But when they return, right now, the US CDC, this is not Maine CDC, this is the US CDC, but when they return from overseas travel, there is still the quarantine requirement. But my understanding is that the US CDC, not my understanding, I am fully aware that the US CDC is evaluating that and may change that very soon for travelers who are returning to the US who have been vaccinated. The challenge of all of these is verifying that. Now, in a lot of parts of the world where many of us have been or worked, it's very commonplace to have a yellow fever card. I had one when I was a kid and when I worked in Southeast Asia and in Sub-Saharan Africa. It's very common to have a yellow fever card. Indeed, I think many people from other parts of the world are more familiar with and accustomed to carrying their yellow fever card. Many people in the United States are not. So furnishing that proof of vaccination when you return to the United States at the border to the quarantine station, that's what needs to be worked out.
Thank you. And since we have 3 minutes, I have one more question. So we wanted to ask you about the public vaccination at the Immigrant Welcome Center. And then we also wanted to announce a press conference. So I don't know if Reza, if you're still on, if you would like to speak on that, or I can't see. Regardless, yes, we wanted to ask you about the public vaccination at that center, and then let you know about the press conference that we're hoping to have on Tuesday.
Yes, indeed. So as to the public vaccination site, and if Liana is with us, she's been helping and instrumental in this effort. What we're hoping to do in the not too distant future is, in recognition of the fact that many people from many communities across Maine would prefer to be vaccinated in a place that is familiar to them, with people whom they know. We're working on a process whereby different groups can sponsor a vaccination clinic at different locations. Liana has really been the brains and the inspiration behind that initiative. And so I would be remiss if I spoke about it, because it's really been she that's been the driving force. So Liana, maybe I'll ask you to chime in on that.
Sure, but I would correct you to say that the brains behind this has really been the community, right? In lifting their voices and saying we need another way. And so the idea behind pop-up clinics is really to, in some ways, sort of turn what we're currently doing on its head and provide an additional resource. It may not be the best resource for each community, but it will be an additional resource, which would enable communities to be the primary sponsor, as opposed to having the large health system be the sponsor and inviting communities to participate in the larger clinic. This flips that dynamic on its head. It becomes the community sponsor itself who's deciding how to set up a clinic in a place that's going to make the most sense for their community, and to help do that registration and to support them as they come into the clinic. And then we, as the state, will help to be a bit of a matchmaker to match them up with a approved provider and ensure that provider has vaccine to do that specific clinic. And so it really becomes the community sponsor inviting the vaccinator to their event. So that is going to be hopefully live on Monday. There's a short application, not super onerous, but we'll hopefully go live Monday. I'll make sure that it gets out to community leaders in this group as well.
Liana, if I may, what we had in mind was really designed in terms of confidence building for the different immigrant communities that we serve. So we thought, by offering our space and showing that the elders in the community and the community leaders, for example, a monk or a mom receiving the vaccination in the public with the cameras and all that, would somehow help in building that confidence in the power of the vaccination. So I would love to work with you. It has been a while since we have worked together, but that was the idea that our stakeholders brought to us, and we're partnering with Unified Asian Community to make that happen.
That's fantastic. Glad to hear
we will
it.
be also more than happy to support that initiative. We have several people, elderly people, who has already vaccinated, and we will be more than happy to work with you.
Thank you, Talon.
I have to just jump in here, because before we adjourn, I'm sorry, Liana, did I cut you off? No. So before we adjourn, I don't want this recording to be outdated by the time before it's even finished. And so just about a minute ago, as I mentioned earlier, that we might be accelerating the eligibility of who can be vaccinated in Maine. And you may have noticed I didn't really provide many more details around that. That is because about a minute ago, 2 minutes ago, Governor Mills just announced that starting next Tuesday, any Mainer 50 and over will be eligible for vaccine. And starting on April 19th, any Mainer above the age of 16 will be eligible. So I didn't want this video to end before and have it be outdated before it was even done. So I wanted to just interject and let everybody know about that. We're going to be making a much more broad public announcement in about 45 minutes, but I wanted this group to make sure that they were aware of that. You should feel free to share that news. It is not embargoed or anything of that nature. It is out there. We're going to boost the signal a little bit more at 3:30. But again, on Tuesday, anyone in Maine 50 and over will be eligible. And then on Monday, April 19th, anyone in Maine 16 and over will be eligible for vaccine.
Amazing.
So I'm glad I could share that. I was looking at the clock because I didn't want us to end before I cut back in to announce that.
Dr. Shah, can I translate that in Vietnamese? I think
Yes,
that will make
please.
Vietnamese very happy.
Please.
Alo, Thung, chị Đào và vui như vậy này, ông Shah nói là bắt đầu từ thứ ba tới đây á, thì những người từ 50 tuổi trở lên là có thể đăng ký để tiêm vaccine, và kể từ ngày 19 tháng 4, những cái người từ 16 tuổi trở lên sẽ được tiêm vaccine. Thank you so much, Dr. Shah.
Of course.
Thank you. So I think we are out of time. I don't know, Thomas, if you had any parting words. I know that we're 3 minutes over and everybody's really busy. So I just wanted to say thank you so much to Dr. Shah for taking the time to speak with us in our community. I apologize to anybody whose questions may not have gotten into today's session. We will work with Dr. Shah's team to get those questions, and we'll hopefully get that information out to you all.
Yeah, as Amy said, Dr. Shah, thank you so much for your time. We'll just leave everyone with this nice parting sentiment. We hope that everyone, this weekend and moving forward can do an act of kindness for someone in their community. We really believe that every little piece will genuinely make our community a much better place. And if you see something, say something. We really want to strongly advocate for our community having a voice. But seriously, genuinely, thank you so much, Dr. Shah, and everyone for attending. It really means a lot to us.
Yes.
And we hope everyone has a wonderful rest of your day.
Yes, thank you. Wait, but before we all log off, can I just give you one piece of good news, because it's really, really good news, and it's talking about the amazingness of community. Our community in Portland suffered a hateful attack on Monday that was, I believe to be racially motivated. So we decided to communicate with the family, and because there was damage done to their car, we wanted to raise money for this family. So we set up a fundraiser with the goal of $1,000, and we released the link yesterday. This morning we were at $832, which I thought was incredible, because I had only had the link up for just a few hours in the night. Well, I just want you all to know that we are at $2,743, and that is Maine and Portland stepping up for their community. So I just want to leave us all with that, because it is definitely making my week. So thank you all so much, and I appreciate you all, and I'm so happy to be part of this space with you. Thank you.
Thank
Thank
you.
you, everyone.
Thank you, everyone.
Thank
That
you.
is great news.
Thank you.
Bye.
Thank you, everyone.
Happy